Hello, everybody. As we gear up for our upcoming annual convention, we are diving deep into the concepts that will define our next era of our profession. This year, our theme is Architects of Change, and it's a call to action, challenging every one of us to design, build, and shape the future of oral health. And today, we are talking about what it looks like to design and change it on a truly global scale. Joining me is Isha Gupta, the Global Head and Senior Director of Public Health and Social Impact for Colgate Palmolive. Isha, thank you so much for being here with us today.
Thanks, Dr. Bellamy. So excited to be here. It's an absolute pleasure to join you, especially under the banner of this year's inspiring NDA theme, Architects of Change.
I appreciate it. To kick off, Colgate Palmolive recently announced a massive multi-year partnership with the World Health Organization. Before we dive into the details, could you give us, our listeners, a brief high-level overview of what that partnership is about?
Absolutely. So at Colgate Palmolive, everything we do is driven by our purpose, and that is to reimagine a healthier future for all, and of course, to make more smiles. And that's why we're very proud of sharing our new multi-year partnership with the WHO Foundation. And our commitment with the foundation is to directly support the WHO, the World Health Organization's independent work that they're already doing to advance oral health around the world. And I'm just very grateful to be here to be able to share more with you and the esteemed audience of listeners of this podcast.
Could you give us a brief overview of the partnership and what inspired Colgate Palmolive to make this multi-year commitment?
Sure. So I know that you and the audience of the podcast are well aware, but the inspiration and core challenge we're addressing, we can all agree, is immense, right? Oral diseases are the most prevalent non-communicable disease, or NCD, in the world, and it affects nearly half the world's population, 3.7 billion people. So despite the clear clinical links between oral health and systemic conditions like cardiovascular disease, diabetes, oral care is unfortunately fundamentally overlooked and deprioritized by global health systems. So the partnership is really designed to focus on that and to change that. And together with the WHO Foundation, we're focusing on three strategic priorities. The first one is about scaling prevention and education by really integrating into already existing and established programs, such as like school health programs. So that's, what does it look like where you integrate an oral health component into a school health program run by the government? The second pillar is focused on supporting independent policy and guidance to help ministries of health build evidence-based cases to integrate oral health into universal health coverage. And then the third is just raising awareness. It's increasing the conversations and advocating for these conversations of getting oral health recognized and giving it space in the global health ecosystem. And so that prioritization just to ensure that it is seen as a core public health priority.
In understanding that partnership, oral diseases affect nearly half the world's population. Why has oral health historically been overlooked as a public health priority?
So we think there's a few reasons why this is the case. And first, there has historically been a separation of the mouth from the rest of the body. So we treat it as a siloed part of the body or part of the broader health system. And so, for example, in both clinical practice and health financing, oral health has been treated separately from general health. And because oral health is treated separately, essential oral care services are usually, we see, excluded from primary healthcare benefit packages. And second, I'm sure you see this in clinical practice, but we have the compounding effect of the social determinants of health. So the neglect of oral health can be exacerbated by factors like economic status or education, health literacy, access to healthcare. And so we've seen people put off care due to transportation or taking time off work or out of school. And for many, that's the reason that something gets put on the back burner. So the positive news here is that we are seeing a shift, right? For the first time in history, oral health has been elevated. It made it onto the global agenda. Recently, it was included in the zero draft of the UN high-level meeting on non-communicable diseases. So it's also been recognized as a non-communicable disease. So we're seeing this growing momentum and a swell of support. And that is truly also why we wanted to sign this partnership at this time with the WHO Foundation, just to capitalize on the movement that we're seeing so we can try and have more impact together.
That's awesome. Let's talk about creating system level change. How does investing in prevention improve both oral health and oral health outcomes?
So, from an economic perspective, the return on investment in prevention is undeniable. For every $1 that we invest in prevention, up to $7 can be saved on restorative care. And we've seen that simple school-based programs can reduce dental caries by as much as 45%. So empowering families with basic self-care and prevention tools is extremely cost effective. Shifting our public health approach from expensive treatment and crisis management to sustainable, proactive wellness. Like that's really where we want to keep going and doubling down on. And also, when we are able to prevent oral diseases, we aren't just saving teeth, right? I I'm sure you can agree with that. We're stopping a cycle of deteriorating health. And as you know, untreated oral health diseases are clinically linked to systemic conditions like cardiovascular disease, respiratory infections, and other diseases. And on a more personal level, prevention can also protect self-esteem. It can ensure that children stay in school and then they go on to contribute to our economy, join the workplace. Um, and all of this typically is missed out on when a child has like a simple tooth pain and has to miss school.
It really underscores the power of preventative care. Now, Colgate is no stranger to this kind of foundational work. Your Bright Smiles, Bright Futures program has reached an astronomical number of children and families over the decades, nearly 2 billion. How has this decades long experience of running that program informed this new chapter?
Yeah, so we were very excited to announce earlier this year that we have reached 2 billion children and their families around the world through our Bright Smiles, Bright Futures program, which is active in over 100 countries. So our journey and legacy with the Colgate Bright Smiles, Bright Futures has really been the foundation of our social impact work, as I said, for over 35 years. And the lessons that we've reached in reaching 2 billion children have directly shaped what we're calling our next phase of BSBF. So, we're not stopping at the 2 billion number. We're really focused on how can we continue to evolve and strengthen this program to reach even more children and ensure we're having impact. So, a few things we've learned. We've learned that the most sustainable and scalable impact occurs when we integrate oral health directly into existing infrastructure. So like a school health platform, not redesigning something that stands alone. Another point is we've learned that driving lasting behavior change requires evolving our educational tools. So what we're doing right now is actually using a human-centered design approach, working with behavior change experts. So using behavioral science to really understand what are the messages that children, parents, teachers, caregivers around the world really need to hear to incorporate behavior change for oral health into their daily habits. And then lastly, we've learned that we need to continue to invest in health for children and families. So through behavior change, forming healthy hygiene habits, which can, as spoken earlier, really pay dividends in adulthood. So healthy children go on to become healthy adults, which in turn raise healthy families and then form healthy communities.
That's correct. So, this global framework is powerful, but as you know, policy only succeeds if it translates into meaningful change on the ground. So, when we look at organized dentistry, what role do dentists have as advocates for prevention and oral public health?
Yeah, I mean, I think we need to recognize that dentists are far more than just clinical providers. They are, to use your theme again, the frontline architects of change. So dental professionals have powerful impact as they're trusted advocates who understand and they can address specific social determinants of health in their communities and where they practice. So on the ground, they can dismantle barriers to care, they can volunteer, they can give back to their communities, including with the Bright Smiles, Bright Futures program, just an example. And by championing these like community-led efforts, dentists can help ensure that oral health is recognized as a fundamental component of overall public health. And then further, through organizations like the NDA, dentists play a vital role in advancing industry accessibility and workforce development, addressing critical representation gaps as well.
I completely agree. NDA members are uniquely positioned to be these advocates. And looking at the broader landscape, where do you see the greatest opportunities for collaborating right now amongst industry leaders like Colgate? And what excites you most about the long-term impact this partnership can have on communities around the world?
Yeah, so there's several things that really excite me about this long-term impact of the partnership. And first, it would be the expansion of essential oral health education through the integration into schools and primary care, which will lead to earlier prevention, improved health literacy, and ultimately a reduced disease burden of oral health in communities. Second, I think there's a potential for large scale impact with the adoption of the WHO technical guidance, embedding oral health interventions into national health systems. And then lastly, the elevated visibility of oral health on the global public health agenda, which is like the third point of that pillar that I spoke about earlier, it can't be understated. So I think the more that we talk about it, we advocate for it, we help people, leaders, everyone understand that oral health is linked to overall health, can only help give it more of an importance in the health discussion we're having today.
So, Isha, this has been an incredibly enlightening conversation. So, as we look down the road, say 4 years from now, what specific outcomes would you say would define success for this partnership?
No one has a cavity. Just kidding. So 4 years from now, we would love to say that success is going to be defined by integrating cost-effective oral health interventions into national health systems. We really hope that this will allow the WHO and the WHO Foundation to assist countries to move from commitment to implementation by reducing friction, aligning partners, and truly like mobilizing support from different stakeholders. And would like to see continued momentum as well, more wins and more successes on a global scale.
Yeah, that's a beautiful vision. And when we're eager to help build. But before we wrap up, what final message would you like to leave for dentists, students, educators, and public health leaders listening today who want to step up and make a difference?
I love that closing question. I think that we all need to remember that oral health is public health. And we really cannot achieve overall health without treating the mouth as the gateway to the rest of the body and as like the gateway to overall well-being. So whether you're a student, whether you're an educator, a public health leader, or one of the thousands of dental volunteers delivering care in underserved communities, everyone's role is vital. And by working together, we can act as true architects of change and embed prevention and help families worldwide to focus on future possibilities rather than present challenges.
Beautifully said. Thank you, Isha, for sharing this vision behind this groundbreaking partnership. And as we work on becoming architects of change in our own communities, today's conversation reminds us that the lasting progress is built through collaboration, prevention, and shared commitment to improving health for everyone. We appreciate Colgate Palmolive's leadership, and we look forward to continuing this important work together. Thank you again, Colgate Palmolive, and our global head and senior director of public health and social impact, Ms. Isha Gupta. To our listeners, thank you for tuning in. Let's take these insights into the annual convention and continue building the future of oral health together. Let's all be architects of change. I'm Dr. Wallace Bellamy.